Tom, we're told that actually 3 victims of the shooting were taken here to Hartford Hospital. One is in fair condition and is actually up talking to doctors and is expected to make a full recovery. Another one is in serious and critical condition right now and is in the ER as we speak. And the 3rd victim ultimately came to the hospital, was resuscitated, and then ultimately died of his injuries. We're told some of the victims had multiple gunshot wounds as well. We talked to ER doctors earlier today, and they can explain a little bit better than I can about some of the things that they're going through to treat patients with these kinds of injuries. Take a listen.
In treating gunshot victims, it's clear that you have to be sure that they have an airway and they can breathe, and in general you're very concerned about bleeding. So you have to identify what is bleeding, either physically by looking at it and stopping it, or with x-rays and CAT scans, identify what the bleeding is, and then go to the operating room and stop the bleeding.
And then after that, patients will need to go through intensive care, and they'll need to be watched, of course, very carefully. One piece of good news that Hartford Hospital says they had plenty of notification before these victims arrived, so they were able to notify all the trauma surgeons. They were able to call the blood banks so that everybody was prepared when these victims came in, so that they were able to treat them at least to the best of their ability. Again, 1 victim in fair condition, 1 in serious condition in the emergency room right now, and 1 unfortunately died of his injuries. Now, we are going to be here on the scene to bring you the latest, especially on that 1 patient that is in the emergency room. But for now, we're going to send it over to George Colley, who's in Manchester, for reaction on the shootings. Hi, George.